Welcome to my channel, Medicine with Dr. Moran. I'm Dr. Keith Moran. If I told you that there's something that you can do to enhance your memory, improve your productivity and creativity, would that get your attention? I'm sure it would. It's something that can keep you slim and reduce food cravings. It would also help prevent colds, the flu, cancer, dementia, and reduce your risk of heart attack and stroke, not to mention diabetes. It would also make you feel happier and less anxious and depressed. Is this clickbait? No, it's not. And what am I talking about? Well, I'm talking about good quality sleep. Everyone needs this, and everyone can benefit from watching this video. In our fast-moving society, many people have chronic sleep deprivation, which seriously affects their health, as I've just mentioned. Today, I want to give you a number of tips to improve the quality and length of your sleep, which will improve your overall health. First of all, exercise is important to set you up for good sleep, but don't do this late in the day. It is important to exercise 30 minutes most days of the week, but please, as I mentioned, don't do it later than 2 or 3 hours before your bedtime, or it can prevent you from falling asleep. I would avoid alcoholic drinks before going to bed. 2 or more drinks of alcohol can rob you of deep sleep and rapid eye movement sleep, which we call REM sleep. And that keeps you in lighter stages of sleep so you don't get as deep. This amount of consumption can also lead to airway obstruction, as the muscles of the airway can relax or even collapse and lead to snoring and sleep-disordered breathing. People also tend to wake up in the middle of the night when the alcohol is worn off, or to make a bathroom run. There are some medications which can delay or disrupt your sleep. Stimulant medications such as decongestants or inhalers for lung disease, as well as some blood pressure medications, can disrupt sleep patterns. If you're taking a diuretic, which is also known as a water pill, and this sort of pill will make you urinate, I always tell my patients to take their diuretics in the morning, but if they happen to be going out in the morning, take it no later than 1 p.m. Otherwise, if you don't, urination might continue on into the night. Now, prednisone, which is a potent anti-inflammatory medication, often prevents people from going to sleep and should be taken in the morning as well. Ask your doctor or pharmacist if you think that any of your medications may be interfering with your sleep. Now, people set an alarm to wake up in the morning, but very few people actually set an alarm for bedtime. This alarm will remind you that it's time to wind down and actually get into bed. Mobile phones have this feature. In iOS, for example, on Apple phones, you can set it up by clicking on the clock icon, as you can see here. This can be very helpful for people. Going to bed and waking up at the same time each day, whether it be on the weekday or weekend, is very important. Probably of all the tips I'm giving, this is the most important tip of all. Trying to sleep more on the weekends won't make up for lack of sleep during the week. And of course, it will make it harder to wake up early Sunday morning. Sleep needs can vary amongst people, but it's important to give yourself at least 7 hours before the wake-up alarm comes on in the morning. We're the only species on the planet that uses a device to prematurely terminate our sleep. Think about that for a minute. Now, make sure your alarm is soothing, because many people who are abruptly woken up from sleep will suffer a spike in blood pressure and a rise in heart rate, and that's caused by the fight or flight branch of the nervous system, otherwise known as the sympathetic nervous system, when they're suddenly awoke from deep sleep. Do not hit the snooze feature, because you will then repeatedly inflict that cardiovascular response again 10 minutes later. It's best that you should get in the habit of waking up just once in the morning. Next, I would avoid caffeine and nicotine. Caffeine is in coffee, tea, soda, and chocolate, and it can have long-lasting effects. The half-life of caffeine is 6 hours, and that means after 6 hours, half of the caffeine you ingested has been eliminated from your body. It also means after 12 hours, 75% of the caffeine has been eliminated. This means if you have a cup of coffee at 10 a.m. and go to sleep at 10 p.m., there will still be 25% of that caffeine from your 10 a.m. coffee still circulating in your body. Now, most people would not think of drinking a quarter cup of coffee at 10 o'clock before going to bed, but this is actually what your body experiences. If you are a smoker, nicotine is also a stimulant, and it can cause smokers to sleep more frequently in lighter phases of sleep and not spend as much time in the deeper stages of restorative sleep that we all need. Smokers often wake up early in the morning because of nicotine withdrawal. If you are sleepy during the day, don't take a nap after 2 p.m. This is another helpful tip. Naps can make up for lost sleep, but late afternoon naps make it harder to fall asleep at night. Taking a hot bath before bed can be helpful. Your body temperature drops after getting out of the bath and may help you feel sleepy, and the bath itself can help you relax and slow down so that you're more ready to go to sleep. Sunlight exposure is also important. Getting outside in natural sunlight in the morning without sunglasses, even for a few minutes, help regulate your sleep-wake cycle, which is part of your circadian rhythm, or body clock as we often call it. From this journal reference, this schematic shows how sunlight or artificial light stimulates the retina at the back of your eyes. The sunlight comes in from the top part of your visual field and gets projected in the back of the eye along the lower surface of the retina, and that stimulates some special cells, which are photosensitive retinal ganglion cells. Now from there, it gets conducted through different parts of the brain, and ultimately it tells the pineal gland in the brain to stop making melatonin in the morning. Now melatonin is often called a sleep hormone. Now if you can't get outside, exposure to very bright lights in the morning will let your brain know that it's morning and turn off melatonin production as well. Turning down the lights in the hour or so before bedtime is helpful at optimizing melatonin production and making you feel more sleepy. Avoid looking at bright computer screens or cell phones in the hour or two before bedtime, or melatonin production can fall. If you have to use your device, you can set night shift to an appropriate time and then increase the color to the warmest. This will improve your sleep. Alternatively, if you don't want to do that and you've got bright lights late in the evening, you can buy blue blocker glasses. These are red color, and if you're reading later in the evening, it reduces the bright lights going into your eyes. Now, these glasses can be bought on the internet and they're relatively inexpensive. It's important also that you relax before going to bed. Try not to pack your day so full that there's no time left to unwind. Relaxing activities such as listening to music or reading can be part of your wind-down ritual. I would avoid eating or drinking liquids late at night. A large meal, of course, can lead to acid reflux symptoms, which can reduce deep sleep and lead to awakenings. Fluids can lead to needing to go to the bathroom during the night, which you want to avoid. Now, what should your bedroom actually look like? Well, ideally it should be very dark. Make sure you have curtains that block out light completely. Blackout curtains work well. The room should, of course, be cool. What's the recommended temperature? Well, recommended temperature for most is 18 degrees Celsius or 65 Fahrenheit. This is ideal for most people, assuming standard bedding and clothing. This often surprises patients as it sounds a little too cold for comfort. The temperature will, of course, vary depending upon the person. Many sleep physicians who treat people with insomnia often recommend a trial of actually reducing the room temperature by 2 or 3 degrees Celsius or 4 to 5 Fahrenheit from what they typically use to see if this is helpful. Now, your bedroom should be free of gadgets. Make sure that your mattress and pillow are comfortable. Remember, you're spending a third of your life here. You want to make sure that you're happy with what you're sleeping on. Don't have bright lights in your bedroom. Try to minimize noise in the room during the night so any noise won't wake you up. Now, I would avoid watching the clock. Turn the clock face away from you so you don't get concerned about how long it takes you to fall asleep. Don't lie in bed awake. This is very important. If you've been in bed for more than 20 minutes, or if you're starting to feel concerned that you're not going to sleep, get up and do a relaxing activity until you feel sleepy before going back to bed. The anxiety of not being able to sleep can make it harder to fall asleep. Now feel free to share this video to others who it can help. We all struggle with sleep at different times during our lives, and the knowledge that I've imparted in this video is valuable to everyone. I hope these tips will improve the quality and duration of your sleep so that you can reap the health benefits of this every day. Thanks a lot for joining me today on Medicine with Dr. Moran. Get healthy and stay healthy.